This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Hi, welcome back. Well, I think there isn't any doubt that one of the big looming challenges before Congress and the President is what to do with the entitlement. 75 million people, 2007, began to become eligible for Medicare, and then over the next 25, 30 years in Social Security. Dr. Stuart Shapiro is here, is often in the case. He's one of our go-to guys when we start talking about all things health care, and today, particularly Medicare. Dr. Shapiro, welcome.
Hi, Terry.
Well, look, let's get into this business of Medicare, and you can tell me if I'm wrong. When I look now at what's going on in Washington and Harrisburg, it doesn't seem that they're looking at Medicare reform holistically. They're saying, let's just cut the providers, and not the recipients, but the providers are, maybe I'm on Mars here, but it looks like it's just cut providers, cut providers, cut providers, and you all do more with less.
Well, the elderly in Pennsylvania and across the country are being hurt by the Congress of the United States today. Every time they look at balancing the budget, they say, where can we find a pay for? And in the last 2 years, they have cut Medicare, and especially to the frail elderly who are in nursing homes. Now, first, Obamacare.
Yeah, but let me pursue that a minute. Are they hurting him by lack of funding, or are they hurting it? I mean, I was told, and you'll correct me, you're the expert, that it was mostly provider cuts, which then got translated into damage. Or you're saying that they're actually cuts themselves that, go ahead, finish. You see where I'm heading
no.
Here.
The reality is, and I'll use nursing homes as an example. Pennsylvania nursing homes, the quality has improved dramatically over the last decade. It's the best in the country. What the Congress has done is they've said, we're going to cut back funding. And if they cut back funding, staff has to be cut back, because the margins or the amount of revenue in nursing homes is so thin today. They have so little room. And then when you combine it with the Medicaid problems in the state of Pennsylvania, it's a real double whammy. But let me be very specific. Obamacare took $15 billion out of care for the elderly in nursing homes. Then along came further deficit reduction last year, and they took because the super committee failed, they took another 2%. And then last week or last month at the end of February, they took another $50 million out of Pennsylvania Medicare.
So what you're saying is that when they do these cuts, it means that you'll reduce staff, you'll reduce programming, all the things that make nursing homes and hospitals and other healthcare institutions function are squeezed, and that ultimately affects the quality of care. It seems logical to me.
Because of these Medicare cuts, 37% of the nursing homes are reducing staff. They're delaying renovations. They're cutting back on benefits. And all of that leads to turnover. But the problem isn't just Medicare. It's Medicaid. 2/3 of the patients in Pennsylvania's nursing homes are paid for by Medicaid. Historically, Medicare has supported the chronic underfunding, or paying far less for the care than it really cost. Now, with the recent budget from Governor Corbett, who's facing serious challenges, the whole industry is on the verge, the whole profession, of being destabilized. And we're seeing hospitals telling us that their discharge planners are having difficulty placing or putting into nursing homes individuals on Medicaid.
So people who go, who should be transitioned, it's now become extraordinarily difficult to do.
And that's causing backups in hospitals.
30 seconds left in this segment. I mean, this crisis has to, at some point, reach a breaking point, doesn't it?
Well, we're working with the Corbett administration to restore the cuts, because I know they believe and are committed to the elderly. We know that Governor Corbett and the legislature cares about the elderly. And we believe that in the end, they will recognize that the care, if you want good care for the elderly in nursing homes, you must pay for it.
That's a good analysis. Talk a little bit about, let's discuss this business of what's being done and what could be done to reduce costs without reducing access and the quality of care. I think I got that right. Access and the two things that I know you and I have chatted about.
Well, regulatory reform is always important, because whoever is providing health care is subjected to lots of duplicate regulations which need to be changed at the federal and state level. And I must say, the Corbett administration has articulated a vision of reducing regulations, and we're actually working with them to do that, and that's good. But there's a second area that is costing every consumer dollars every day in the healthcare system, and that's the lack of real tort reform or lawsuit abuse reform. There are lawsuits being filed in Pennsylvania against healthcare providers every day that are frivolous, hundreds and hundreds and hundreds of them. And what they're being filed primarily by out-of-state trial lawyers who have seen the rating of Pennsylvania as the best climate for trial lawyers in the United States. Pennsylvania's consistently rated there. And so they come in, they advertise.
Oh, we see the advertisements all the time.
Yeah, and they say, we're going to file all these lawsuits. And then what we're going to do is we're going to go and say to these providers, oh, come on, settle with us for $50,000 or $20,000.
I get it.
And then they settle, and then they file another lawsuit, and it takes up a lot of staff time. And what this legislature needs to do is pass real tort reform. Now, the House of Representatives passed a bill led by Mike Turzai and Harrisburg legislator Glenn Grell. They passed a bill of real tort reform because it puts limits on punitive damages.
And is that now in the Senate?
It's now in the Senate.
Tough. It's always been a little tougher going in the Senate for tort reform.
The trial lawyers and their associations spend hundreds and hundreds of thousands of dollars a year on political contributions. They are supporting trial lawyers from outside Pennsylvania and also, of course, from in Pennsylvania. But there is a real need for lawsuit abuse reform. It's sitting in the Senate, and it needs action.
Well, what's your sense about whether there will be action?
Well, it's an election year, and it's a controversial issue. But if the Senate is serious about improving quality of care and letting staff in hospitals, in nursing homes, in doctor's office spend time and attention caring for patients and not just responding to frivolous lawsuits, the system would improve, the quality would improve, and dollars would be saved.
And are you reasonably tough year, election year? As you know, lawsuit abuse reform has been on the agenda for a long time. Governor Rendell, I think, in all candor, was not crazy about it. I think that's safe to say.
Governor Corbett has made lawsuit abuse reform.
That's right. Corbett has, and
we passed one,
now.
and the legislature did pass one piece, but that is only a small piece of what needs to be done. And frankly, I've stopped handicapping elections or legislative battles.
People think I ought to too, but go ahead.
But that's what you do, not me.
Well, we'll see. Well, look, as always, I want to thank you for coming on. I think this is a great update, and you'll keep us surprised as we move along. It looks like, my bigger point before you go is that I've argued for a long time that we're staring at, and you picked the number, $65, $85 trillion in entitlement reform problems. Unless we do this is what we're facing in 25 or 30 years. And that means not just cutting, but it means figuring out a way to broaden the support base, you know what I mean, to figure out a way to pay for this. At the same time, we don't damage the folks who need it. And Congress will not do this. As you point out, they just sit and talk and don't do it.
And there are solutions. It's going to require people having serious discussions and moving away.
And political courage, right?
And political courage, and stop just a lot of rhetoric. But it can be done, and we've got to do it because we have 10,000 Pennsylvanians turning 65 every single day.
That's exactly
and if we
right.
don't address that problem, they're going to have no place to go for their medical care.
Yeah. And with the affordable health care, the concern is that we'll have fewer doctors, and most of them will be attached to an institution. That's nothing inherently bad in that, but the entrepreneurial nature of it, where doctors can work a few more hours and make a little, all that will be gone. And everyone I've talked to, experts say we got real concerns about access and quality.
Well, the real issue is with Obamacare, that it increases the number of people that will be on Medicaid, which are paid for this year, will be paid for next year. But come 2015, the burden on Pennsylvanians from that legislation are going to be just incredible, and there's no way that Pennsylvania can afford to assume the burden that's being shifted from the federal government to the state government.
Great point. All right, we're shifting gears. Terry Fitzpatrick is here. He's a former member of the Public Utilities Commission. He now heads the Energy Association. We're going to talk a little bit about the impact fee and Marcellus Shale and some other important energy topics that you want to pay attention to. And we'll see you in a moment.
This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source.